Well, let's go ahead and get things moving. Just want to be mindful of time and everyone's Zoom schedules. So my name is Jo Glaviano, and I'm the program coordinator with Aurora Health Alliance. You may know our executive director, Mandy Ashley, who had her baby over the weekend, 3 weeks early. So Mandy is now on parental leave, and I'll be just kind of helping out while she's away. So thanks for being here today. Really appreciate it. Please know that we are recording this, so that way if you want to go back and look at it, or if you want to share this meeting later on, you can do so. It'll be on our YouTube page. And I'm going to turn it over to Kathy Snell with Aurora Mental Health Center, and we'll then introduce Summer.
Yeah, Jo. Welcome, everybody. Glad you made the time today. We are lucky to have a presentation today by Summer Gathercole, who is the senior advisor to Governor Polis, and to talk to us about the Colorado Behavioral Health Task Force and the blueprint that has been developed from that task force. In the spring of 2019, Governor Polis directed the Department of Human Services to create this task force with the goal really of improving the current behavioral health system in the state. So this task force had several subcommittees and worked really quite tirelessly. I was certainly on the outside looking in, but hearing a lot of feedback and a lot about the work that was being done. So a lot of people put a lot of time into this effort, and they produced a report and recommendations for how to move forward with those improvements in the state. So Summer was central to that process, and I know that she has had the opportunity to present a lot to a lot of groups about this important work. And we're glad to have her today, because I think that the changes that are being recommended and the changes that will move forward in the state will impact the system across the state, and we certainly hope in a very positive way. So moving.
Great. Kathy, thank you so much for that warm introduction. Good morning, everybody. I am just thrilled to be here with you today. And as Kathy shared, this task force came together in the spring of 2019. Hundreds and hundreds, if not thousands of hours were spent by people really developing the recommendations for behavioral health reform in our state. The one thing I'll just share before we kind of get into our formal presentation is that I think the most exciting thing is that it is happening. I mean, we are moving full steam ahead. In fact, we submitted our blueprint to Governor Polis in September of 2020, so just a few months ago. And there is an amazing amount of work that is already underway. And so I think that just speaks to how much the governor and this administration sees this as a priority. I think it speaks to how much our legislators and just all of our stakeholders across the state know that there's this huge behavioral health need that we need to address. And so it's exciting just because how many of us have sat on committees or work groups or task force and come up with recommendations that just don't go anywhere, and so we relied a lot on some of the past work to really build on the recommendations in the blueprint. So I'm here today. I'm here with my colleague, Kevin Neimond, who is our Director of Legislative Affairs at the Colorado Department of Human Services. He and I are going to tag team a little bit and share kind of an update on the work so far. We want to share with you a piece of legislation that's going to be introduced next week, and then we can open it up for discussion and go in whichever way direction people want to go. So I'm going to start sharing my screen with that. Kevin, I will kick it over to you.
Sure. And Summer, you'll share your screen. Is that what you said? There we go.
Yep, right now.
Oh, awesome. Thanks. And thanks to all of you for having us here today. My name is Kevin Neimond. I'm the Department of Human Services Director of Policy and Legislative Affairs. So yeah, Summer, that was a great introduction of all the work that's happened that you have been helping to shepherd through the process. And it is exciting to see all this come to fruition. So the task force generated nearly 150 recommendations, and as Summer mentioned, in September, the group released its blueprint, as well as several other reports that outline the vision for reform. And that blueprint for reform includes what are known as the big three to system reform, which are to, number one, create a behavioral health administration to ensure a standard of high quality, integrated, people first behavioral health care that's accessible to all Coloradans. So not just metro pockets, but all Coloradans. The second piece of that is to implement care coordination that includes a regional support structure that connects the dots on patient care. And finally, the third of the big three is to focus on the fundamentals for a strong behavioral health system. The task force defined these as access, affordability, workforce accountability, consumer and local guidance, and whole person care. Summer, could you skip to what would be, I think, slide 3, maybe it might be the next one there. Thanks. So this work is envisioned to be implemented across 3 phases, and I'll go through each of those, and then we'll focus on that first piece, which is to create a behavioral health administration. So phase 1 includes the creation of that behavioral health administration that I mentioned earlier, as well as increased attention to telebehavioral health and statutory and fiscal review of current law and current funding to identify any changes that may be needed to implement the components of the blueprint. So that telebehavioral health one is one that I want to talk about here for just a brief second. Telebehavioral health has always been bubbling as a potential mode for the delivery of behavioral health services. COVID, obviously, as you're all aware, has pushed that directly to the forefront. And we want to be able to leverage some of those advances that have happened and that are benefiting people across the state. One important point I do want to mention here, though, is that we understand that telebehavioral health is not the be-all, end-all mode of service delivery. We know that in some cases, it's a perfectly fine model for service delivery. However, it's not always a one-for-one substitute for in-person care. So we want to make sure that it's very clear that when appropriate, telebehavioral health is something that should be leveraged. The second phase of this calls for the implementation of a regional care coordination structure. This is a really interesting component of the recommendations from the task force, and one that drew a ton of debate as to what does regional care coordination really look like. There's a lot of different models across the state for care coordination right now. So what is this going to look like? We realized pretty quickly within the task force that this one was going to take some more time to do and do the right way. So this one has been moved into phase 2 after the behavioral health administration is put in place. And along with the regional care coordination model, you'll hear a theme today throughout my comments and Summer's comments that all of this is intended to be community, stakeholder and partner driven, and the design for a regional care coordination structure is no different, in that we'll be reaching out to a wide variety of folks across the state to help with that planning effort. And then finally, the third phase sees the Behavioral Health Administration regularly reviewing the remaining recommendations that were not included as part of phase 1 or phase 2. And as I mentioned, Summer and the Behavioral Health Task Force generated nearly 150 recommendations, many of which we're trying to act on right away, but some of them might not make it until we get to phase 3. Summer, if you could move to the next slide. As was mentioned in the introductory comments, there is a really exciting development here, and that is related to legislation this year. So Summer indicated, and I think this was a wonderful point here, that we've all been part of task forces before, right? That you put in all this work, you dedicate your time, you take time away from your core professional duties and sometimes even your family duties to participate, and then those recommendations just don't go anywhere. They fizzle, they sit on a shelf, they get bogged down in politics. The mood changes for a variety of reasons. They never get implemented. The task force, however, is not like that. This is a full speed ahead initiative. And what you will see as we talk about the legislation, this is the first part of hitting that gas pedal and really moving toward making a difference for families and individuals that need better access to behavioral health services. But before we talk about the legislation specifically, let's talk about what the problem is so that we can define it, that the Behavioral Health Administration is seeking to solve. Summer?
Thanks, Kevin. So one of the things that the Behavioral Health Task Force did was conduct a financial analysis just over a year ago. And the big kind of finding that came out of that is that at the state level, we spend about $1.4 billion in behavioral health funding and programs across at least 10 different state agencies and over 75 different programs. Each of those state agencies define data differently, collect data differently, have different reporting requirements, and they all have their own staff, program staff, evaluation staff, accounting staff, monitoring staff, et cetera. So at the state level, what that means is that we're not spending our dollars as efficiently as we could be. We're not being as effective with our resources because we're not, despite maybe best intentions, we're not coordinating as good as we could or should be. So it just means that there's a lot of inefficiencies at the state level. What we also heard from providers, and I'm sure that many of you on the phone right now can appreciate this, we heard from providers that the administrative burden that they are experiencing is just, it's taking them away from patient care, right? And that's because, again, all of the state agencies are requesting, different data, have different reporting requirements. So providers are spending a lot of time focusing on that and not necessarily providing the patient care or redirecting their efforts towards patient care, which is what we really want. And then lastly, for the consumer, there's a huge burden on the consumer right now. So one of the things that the task force did was hold public testimonies throughout the era of the task force. And we heard from people all over the state, people with lived experience, their family members who said, I was so frustrated because from their point of view, and they didn't say it in this way, but really they had to find the provider that had one of those 75 funding streams to meet their needs. So they were constantly calling around. They were constantly felt like they were being bounced around, depending on their potential diagnosis. They were kept getting redirected to different state agencies. It was just incredibly frustrating. And a lot of people just shared that they stopped trying to access help because it was just too frustrating, too draining. If you're already experiencing a behavioral health condition, the last thing you want to be doing on top of that is trying to figure out and maneuver through our very bureaucratic system to figure out how to get help. So what we want to do is figure out how do we make sure that we have the infrastructure at the state level to make sure that we are using our resources as efficiently and effectively as possible. So that's really how the idea of this Behavioral Health Administration came about. It is a new entity that would help to oversee all behavioral health programs and funding at the state level. So we would be looking, and we'll talk a little bit more about the analysis in a few minutes, but really looking at all of those programs and funding streams and trying to figure out what should move under this new entity, this Behavioral Health Administration, what should be coordinated, what should be aligned, just how can we be very intentional at the state level to ensure that we are working together. It would actually be the first time that Colorado would have a cohesive statewide strategy to address the behavioral health needs here. And we know that before COVID, we had about 1 million people who were experiencing behavioral health conditions. We all anticipate that that's going to go up as a result of COVID. And so it's really now more important than ever to make sure that we are making the most of our resources. So part of that is also looking at the data piece, right? So making sure that understanding at the state level, what is the data that we really need to collect? How can we use that data to inform us whether or not we're providing the right services, the right quality services that are really meeting the needs of Coloradans? So we know that we are already collecting a whole bunch of data. We're taking a step back from that and saying, what's the data that we need to be able to determine that our behavioral health system is working, and then make sure that that's coordinated across all of those state agencies. Now, some of it, of course, is going to be driven by funding sources, right? So there's regulations that the feds have based on data sources and so forth. But the idea is how do we make sure that we're coordinating all of that at the state level so that there's less burden for the providers? A couple of other things that you'll see here on the screen. One, on the right-hand side, upper right-hand side, you'll see the Stakeholder Advisory Board. This is really an opportunity for us to make sure that we are engaging people with lived experience, their family members, providers, counties, law enforcement, just all of those different stakeholders that touch the behavioral health system, and have this statewide stakeholder advisory group that really has the influence to be able to give direction to the Behavioral Health Administration. So to be able to say, this is working, let's do more of this, let's figure out how to scale this, or this is not working, let's figure out how we make a course correction, what does that look like, and kind of go from there. The last thing that I'll share here, and we can talk about it some more too, is that you'll see that HCPF is to the side, so healthcare policy and financing is to the side of the Behavioral Health Administration. That is largely because when the Behavioral Health Task Force talked about and came up with the concept of this Behavioral Health Administration, we didn't have the time to dig in and do the analysis to figure out where and how does Medicaid align or integrate with the Behavioral Health Administration. So we're doing a ton of work and analysis and talking with stakeholders over the next 6 to 8 months so we can figure out what that integration and or alignment looks like. And we can talk about that more when we get to reviewing the bill. The last thing I'll just share about the Behavioral Health Administration is that it is not the solution to all of the problems that we have or all of the challenges that we have in Colorado right now. We expect that this will be the mechanism to ensure that we can continue to address those challenges in our behavioral health system and to ensure that the blueprint recommendations continue to be executed in the future years. So, Kevin referenced, we had almost 150 recommendations. We have a public facing blueprint, which is probably 17, 18 pages. It's very high level. We also have a report that is a couple of 100 pages. That's really kind of our guide, if you will, for the next couple of years about what are those recommendations in there? What was the context and the conversations around those recommendations so that once the Behavioral Health Administration is up and running and we start moving into the next phases of our work, we can resort and go back to that kind of multi-100-page report and say, okay, let's figure out what are the next priorities that need to be addressed to ensure that we're improving access to care across the state. So I just want to make sure everyone knows that this is not kind of like the silver bullet solution that we think we are going to need. This is a part of the solution, but there's a lot more work that also needs to be done. So with that, I'm going to turn it back to Kevin just to talk a little bit more about the legislation that we expect to be introduced next week.
Hey, thanks a lot, Summer. At its core, the legislation to create the Behavioral Health Administration has 3 components. First, it requires the state to establish the Behavioral Health Administration first in the Department of Human Services, and that is by July 1st, 2022. And at a very high level, it lays out the duties that this administration must perform. A couple points on this. There was a lot of debate on this one as well as to where the, if you will, home, I guess, destination should be for the Behavioral Health Administration. Should it be in the Department of Human Services? Should it be with Medicaid in the Department of Healthcare Policy and Financing? Should it be in the Department of Public Health and Environment? Should it be its own standalone department? Those conversations are ongoing. However, we did not want to wait for those conversations to resolve, as that will require more debate than time that we have at this point. So temporarily, to get the Behavioral Health Administration up and running, it will be located in the Department of Human Services, and the legislation indicates that this must occur by July 1st, 2022. So that is the beginning of untangling the messy chart that Summer had up earlier that showcases the state's bureaucratic maze. So this is that first piece in untangling that. So the second step to this is the bill requires the state to develop a proposal to create, or a plan to create, the Behavioral Health Administration. And this plan must be submitted to the General Assembly by November 1st of this year. So you can see that's a very, very fast timeline. So this plan has to include funding and legislative recommendations that are needed to appropriately implement the Behavioral Health Administration. That includes initial startup and ongoing operational costs, which programs will be integrated into the Behavioral Health Administration, which programs will be aligned with the Behavioral Health Administration, if not fully integrated. Now, that date was picked on purpose, that November 1st, 2021 date. That date aligns directly with the timeline for considering legislative and budget requests for the 2022 legislative session, so that by the time July 1st, 2022 rolls around, when the Behavioral Health Administration gets going, we've already submitted a plan and had it vetted at the General Assembly for both funding and law changes that need to occur to successfully launch the Behavioral Health Administration. There's two other pieces of putting together this plan that I want to highlight for you. First of all, we know how big of a lift this plan will be to put together, and that it's not going to happen and certainly won't be successful without partners and stakeholders working alongside. I think I might be getting some feedback. If somebody could, wouldn't mind muting their feed. There we go. Thank you very much. I appreciate that. We know that this work's not going to happen without partnership to put this plan together. A lot of people say, yep, as we put together this plan, don't worry, we're going to consult with different organizations and partners. We wanted to make sure that this was crystal clear, though, and not just lip service. So we have put directly into this bill a requirement that the state shall solicit feedback from a number of community partners. That ranges from community mental health centers, managed service organizations overseeing substance use disorders, municipalities, counties, regional accountable entities, you name it. That list is rather girthy, if you will, and lists out quite a few different organizations. And we're not limiting it to those organizations, but we wanted to make sure that it was memorialized in law that this is a partnership guided plan that's getting put together, because we know it will never be successfully implemented unless we have everybody at the table working on it. We also heard loud and clear throughout the task force proceedings that system reform cannot be achieved in a vacuum without alignment or integration with Medicaid and private insurance. So that was something we heard loud and clear. So this bill requires both the Department of Healthcare Policy and Financing and the Division of Insurance, which regulates the private insurance market, to participate directly in writing this plan that's due to the General Assembly by November 1st. We have heard from a lot of folks that Medicaid should be part and parcel of the Behavioral Health Administration right off the bat, that it should be directly integrated. And we don't, that's something that we think is going to take a little bit more time to figure out. We want to make sure that we get this right away. So rather than saying, yeah, let's integrate Medicaid and hope all the pieces fit together, and those pieces are the federal standards, Medicaid criteria, guidelines, reporting requirements, rather than saying, like, let's get all those done right away, we know that this is going to take some time to get done. And that part is going to have to come along a little bit later with the help of this plan that we're putting together along with partners and stakeholders here. So we need to get this right, and we're being very deliberative and thoughtful in our approach, even if it takes a little more time than some folks might prefer. The final piece of the legislation is that by November 1st, 2024, the state must submit a proposal to the General Assembly on where the Behavioral Health Administration shall reside in perpetuity. As I mentioned before, that home location for the Behavioral Health Administration has been a wonderful debate with folks sometimes even flip-flopping throughout the debate as to where they think the home location should be. And it's a debate that deserves to be returned to in the future after we have lessons learned. So this requirement holds the state to that future debate. So you can think of this almost like a very, very soon after implementation review of lessons learned that will be included in a report that will be put forward to the General Assembly, so that if any changes do need to be made to law or funding, whether that's the home location or other items, those can be debated during the 2025 legislative session based on the recommendations included in that November 1st, 2024 report. There are a few other activities. Summer, if you could go to the next slide. We're doing quite a few activities in parallel. Again, this is still with that bias for action, if you will, of moving quickly, because we know how important this is to families and individuals across the state. You'll see, as in the next piece that we'll talk about with Summer, we're doing something in parallel with this legislation. So while the legislation is going through this session, and it will be introduced on February 16th, which is quickly approaching, which is on Tuesday, in parallel, we're also beginning the activities that will help build toward that November 1st, 2021 date for getting the plan submitted to the General Assembly. With that, Summer, I'll turn it over to you to talk about those activities that we're doing right now with an outside entity called Health Management Associates. We wanted to bring in an outside set of eyes and expertise on our bureaucratic maze, because let's face it, we have helped and in government to create, if not been the main architects of that maze that you saw in Summer's slides. So it was very important to us to bring in somebody with fresh eyes from the outside to help us untangle that web of funding sources and programs that make it so challenging for the individual to receive services. Summer?
Great, thanks so much, Kevin. So many of you might have heard of Health Management Associates before. They are a national firm, but they've done a lot of work in Colorado. Specifically, they did the needs assessment for the Office of Behavioral Health last year. So I think what's great is that they already have a really good understanding of the landscape of behavioral health in Colorado. They know a lot of the partners and the stakeholders, so they have been able to just jump right in. So HMA is doing a couple of pieces of work for us right now. The biggest one being the analysis of those 75 plus programs over those 10 state agencies. So they have already started meeting with those agencies, first as a kind of introductory, let's review the process and so forth, but starting now to get into conversations with the technical conversations with the program staff and the accounting staff and so forth to really understand for every program, what is that program doing? What are the program outcomes? What are the funding sources for the program? What are the strings attached to those funding sources? What are the staffing, the budget, the data and IT platforms, just so that we, et cetera, et cetera. And it's really just to make sure that we have this really comprehensive understanding of all of those different programs. And I'll share with you that as they've actually already started to dig into their work, we're finding that we didn't actually identify all of the programs last year when we did that financial analysis. So it's well over 75 programs. We're still trying to figure out what that number looks like. But having all of that data will then allow us to kind of take a step back and look at it and say, okay, let's start talking about what makes sense to move under the Behavioral Health Administration, where it makes sense to coordinate, to align programs for various reasons. And those are kind of options that the Health Management Associates will put in front of the exec committee and kind of share what those options are and the pros and cons of each of those options. One of the other things that HMA is going to start doing and will be really focused on in March and April is getting stakeholder feedback, right? So we anticipate that in early March, we're going to start having some of those initial findings, right? So we can go back to our partners across the state and say, hey, here's what we're finding, here's what we're thinking, tell us what your reactions are, tell us what the unintended consequences are, so we can have a lot of those conversations throughout March and April. Some of the other work that HMA is doing in relation to this is that deep dive analysis of Medicaid and private insurance and helping to identify really what does alignment or integration look like. The big thing I would want to emphasize here particularly is that HMA is not making the decision, CDHS is not making the decision, HMA is providing options and laying out the pros and cons for those options. That will be discussed within the executive committee, and then the executive committee will work with the governor to come up with the final decision. So this is not something that any one person or department is making that final decision. I want to make sure that that's really clear. Our executive committee is made up of the directors of the Department of Human Services, Healthcare Policy and Financing, Public Health, CDPHE, Public Health and Environment, Division of Insurance, our Lieutenant Governor, and then Douglas County Deputy Manager Barbara Drake. So that's our executive committee. And again, they will also be hearing all of the stakeholder feedback, and they will be participating in some of the stakeholder meetings. So they will be kind of hearing all of that feedback along the way and not making any recommendations or decisions with the governor in a vacuum. So I think those are all just kind of some of the technical pieces to understand. Alongside all of that work, the pieces that HMA is working with us on is really conducting a statutory review to understand, what are some of the legislative changes that might need to be considered with the creation of the Behavioral Health Administration, as well as some of the other task force recommendations that came out. And then finally, the last piece is really identifying the funding opportunities. So we know it's going to take resources to implement more of those recommendations coming out of the task force. We want to think creatively about what does that look like here in Colorado. So I think what comes to mind first for everybody is kind of thinking about how do we leverage our federal Medicaid dollars better or differently. So we have some opportunities to do that. But we also have opportunities to look at other dollars coming into the state and how they could be used to strengthen our behavioral health system here in Colorado. So for those again who need more of a visual, here's a little bit of the project timeline for HMA, just so you have a sense of what that looks like. But I'm going to pause there because I think Kevin and I have done a whole heck of a lot of talking. We definitely want to like open it up for questions and conversation, so it's not just us talking at you.
Yeah, this is the fun part. We'd love to hear what you're we'd love to hear what you're thinking about this. And there's no question out of bounds, big or small.
I don't see any questions in the chat yet, but feel free to do that, or you can just unmute yourself. I did have a question. How is HMA going to engage and solicit feedback from stakeholders?
So as I said, they're going to be doing that in March and April. And I think as they get further into their findings, we'll figure out what's the right way to structure that and make sure that we're getting feedback from all over the place. I know we've got a couple of kind of lists here on our end of different stakeholders that we can reach out to and say, push this out to your members, push this out to your stakeholders. So Joe, we could certainly add this group to that list as well. So if there's interest in participating, you know, we can send it to you and then you can send that information out as well. Again, this is not something, you know, we can't share it, we can't say it enough that this is not something we want to do in a vacuum. We need stakeholder engagement and support. We need you to tell us, yes, this is going to work, or that's a blind spot over there, it's not going to work because of this. And so we're open to hearing all of that feedback.
That'd be great. Yeah, we'd be happy to help promote that.
Great.
In addition to HMA and the executive committee, are there just staff from other involved organizations? You know, I think of OBH for sure, and other organizations that, you know, kind of have funding perhaps in this matrix that are involved in the process now. Are new staff being hired yet, or is that the November kind of target? How is that kind of structure working?
Sure, that's a great question. So, you know, I focused a lot on the technical work that HMA is going to be doing. They're also working on a change management plan, right? So really, how do we engage all of these employees from these other agencies in the conversation, make sure that they know what's happening, why it's happening, when it's happening. Again, no decisions have been made at all. Our North Star, and we know there's going to be tough decisions, right? Like, the North Star that we keep referring to is what is best for Coloradans who need services. I mean, that is really like when we're grappling with like, how are we going to figure this out? What are our options? What we will always come back to is what's going to be best for Coloradans. So HMA is also working with that change management plan to really make sure that we are communicating well enough, bringing people along, engaging them in the conversation so we can take advantage of their expertise. So there's that piece of work that's happening too. And one of the other things I neglected to share earlier is that we have a different contractor who's been brought on to really work with and get feedback from different populations across the state. So in the blueprint, there were, we identified a number of what we call marginalized populations, you know, who are underserved across the state that we need to do a better job of engaging in this work. And so we have this other contractor who's actually just working with people with lived experience and their family members and helping to get from them, how do we design the system, right? So how do we make sure it's one thing for us to say like, here's the infrastructure and here's the management piece, but it's a whole other thing to hear from on the ground. Help us design this and figure out how it's going to work. You know, when you how do you want to reach out? How do you want to communicate? What does that look like? And really get into some of that detailed work. So especially when we get to our next phase and we start really thinking about, okay, care coordination, we already have some really good intel from people who are using the system about how that's going to work and not work. So I think that's important for you to know. And then the last thing I'll just share is that no staffing decisions have been made. You know, part of that will be in the proposal for November of like, what does that staffing look like? What does the management look like? You know, those are lots of the details that we anticipate to have in the fall of 2021.
Thank you. There are a few questions that came in. The first one is, I'm curious what data HMA collected related to behavioral health thus far.
Well, they are just starting out. So they really started digging into that data analysis last week, and they have a very long, large spreadsheet of information that they're collecting for each of those programs. So it really is doing that deep dive of, for every program, what are the program outcomes, what's the staffing, what's the budget, what are the funding sources, what IT platforms are they using, what data platforms are they using because they're required to use it, and so forth. So it's a very, very long list. And I know they're actually creating a scorecard, which we'll probably be able to share later on this spring, that really kind of gives an overview of all those different pieces.
I wonder too if it's worth mentioning, because you had mentioned earlier, Summer, the needs assessment, what used to be called the population and needs study that HMA completed, and that is available, I think, on the OBH website.
It is, yes. And I think that's one of the great things about having HMA do this work as well, is that they're really great about stepping back and connecting the dots across the system. So even though, for instance, I wasn't necessarily deeply involved with the needs assessment, obviously I've read it, and but I don't know it as well as they do because they wrote it. So it's great that they can be like, well, in the needs assessment, we heard this, and now you're hearing this over here, and let's figure out where that intersection is. So it's been really great to have that perspective as well.
Great, thank you. Another question, what has the discussion been thus far regarding alignment of private insurance and Medicaid?
Kevin, do you want to jump in, or do you want me to jump in on that one?
No, that's okay. I was, I thought it's a great question and it's really interesting. So no, I was nodding my head. I was like, oh, this is a good discussion. Yeah.
Yeah, I mean, so that is, there, Kevin referenced earlier, there's been some discussion, and there are lots of different opinions about kind of what does that alignment look like? What is the role of insurance? What's the role of Medicaid? And we are just now starting to kind of HMA is starting that analysis so that we can really start having those conversations in March and April, so that we can kind of share from our perspective, well, and from HMA's perspective, really kind of here's what they're finding so far. They're talking with a number of other states that have something similar to a behavioral health administration. Some of those states have, just as an example, have Medicaid within that behavioral health administration. So they're talking to those states to say, tell us what's working, what's not working. They're talking to the states that have a BHA and a separate Medicaid entity, and talking to them and saying what's working, what's not working. So we were able then to come back in March and say, here's what we're learning, here's what we're finding. Now let's start diving into those conversations and tell us from your perspective. Again, what are we not thinking about? What do you want us to consider? So we can start having those conversations in March. And I'm sorry, I feel like a lot of this is like, it's coming. And I promised you it is. We just want to make sure that we have at least some data initially, I think, before we really dive into those conversations. I will say that having been in all of the conversations with the executive committee, there really is truly this commitment to saying, like, let's just do what's best, and so we've had a couple of meetings where people have said, like, well, like, has a decision really been made about where the BHA is going to live? And the answer is no, because we really don't know what's going to be best yet. CDHS will house it for now, but there's no final decisions, and it's not like there's not fighting around like, I don't want it, and there's not fighting saying I want it. It's really just about like, what's going to be best and how do we make that happen?
Sure, thank you. We know how much data collection, takes, and how long it takes, and what that looks like. And yeah, thank you. Why don't we take one more question, and then let Summer and Kevin continue on. Will BHA address the needs of more crisis centers and longer term placements, especially for youth? The wait lists are incredibly long. People remain in ERs while waiting for a bed in a crisis center.
Yeah, I think that, I think what we would be looking at is once the Behavioral Health Administration is put in place, those are the exact types of issues that the that the organization would tackle. We have heard loud and clear from numerous folks about the need to make sure that children, especially children and youth, especially do not get lost in the shuffle of saying, well, let's deal with the adult population first, and then children and youth take a backseat. So we've heard quite clear that needs to be a key component of what the Behavioral Health Administration's work is doing. In the specific legislation that's going through the General Assembly this year, it does not get to the level of specificity of outlining, for example, crisis centers or longer term placements and things like that. But that will certainly be part of the purview of the Behavioral Health Administration once it's up and running.
And certainly, I think when you look across all of the departments that will end up being aligned, the funding for those longer term placements is represented there through child welfare and through juvenile justice. And so that makes sense that would be at the table.
And the other thing that I'll just add to that is that one of the other pieces of work that we're doing is developing the plan to expand the safety net system. So certainly that is looking at how do we make sure that we have the right set of services across the continuum. And what the BHA will be responsible for in the end is really making sure that we're setting standards so that the same continuum of services is available and accessible to Coloradans, regardless of where you live or what your income is and so forth. So it's going to take us a long time to get there. It's not going to happen overnight, but eventually we will have kind of those standards and accountability in place.
Great, thank you both. And there was a question about the website address for OBH's needs assessment. We can check that out and throw that in the chat.
I'm putting that in the chat.
Awesome. Thanks, Kathy.
Yep.
Thank you. And so we've got here on our screen our webpage, which definitely refer people to go to. We have probably more information than you would ever want to know on our webpage, but we include lots and lots of details there. We record all of our meetings. Everything's open to the public, so we try to be really transparent. We've talked a lot today around the Behavioral Health Administration. And you'll see there that we also have a survey that closes this Friday. So if people want to dive into that survey and provide some more feedback, there's an opportunity to do that there. Again, you can access that via our webpage. There's also other pieces of work that's going on. So just as a few examples, I mentioned the plan to expand the safety net system. We also found that during the time that the subcommittees and the task force were meeting, there were a number of conversations around the intellectual, developmental, and disability population. And while these conversations popped up, what we realized is that we didn't necessarily have the right subject matter experts sitting around the table to be able to provide really the right recommendations for this work. So we actually have a co-occurring disability behavioral health work group that's meeting right now and starting to develop recommendations that they'll have done by this May that we can then integrate into the larger implementation plan. So that's another piece of work that's happening. Again, all of those meetings and that information is on our webpage as well. So definitely would encourage folks to go to that webpage if you want to dig into some more details.
Yeah, we really appreciate the opportunity to be with you here today to talk about all of this work and specifically about the legislation. I don't know if the Alliance takes positions on legislation and bills in front of the General Assembly, but we would love to earn your support of the bill if you do. Is that something that you as an organization do?
Well, I will say that advocacy is a piece that we consistently look at and reassess when we are considering support of things like legislative pieces. Rich, I don't know if you want to speak to that. Rich is on our advocacy committee, but it's certainly something that we take into consideration and kind of look at on a case-by-case basis in terms of considering our board, et cetera, and our advocacy guidelines.
Yeah, this is Rich with on the Rural Health Alliance board. Yeah, I think this particular advocacy matter will come up at the next advocacy meeting within the AHA. We have a little work group or task force on that. And I was just really struck. I really appreciate one of those first graphics that show the intense complexity of the mental health system within Colorado. Because for one, I know it's going to be expensive. I mean, what you're advocating is it's going to hit the budget. We don't have a budget in Colorado, but it's going to be so much more expensive if we don't do anything. And I know in dealing with legislature, joint budget committees and so forth, it's so difficult to say, yeah, it's going to take, we're going to have a short-term hit, but it's going to pay for itself 100 times over in the future. That is so hard. So you guys are going to need advocates, and I can't myself, I can say, yeah, we'll support it, but we'll have a, we'll get together and make sure that we're all united on this. And I can't see why within the Aurora Health Alliance that we wouldn't be going to need it, because it's going to be tough to get the whole program through, just the way we are in Colorado. But thanks, guys.
Great. Well, thank you for that. And thank you so much for having us today. Joe, I think you have the deck, so you can feel free to circulate it to this group if you want, just so people have easy access to it.
Awesome. Thank you so much. Thanks, Summer and Kevin. Really appreciate your time and the information. It's really great to get a good look at how this happened, what's happening. It's a lot of exciting things happening in behavioral health. So thanks for that. Kathy, I think you're up with the Colorado Behavioral Health Council.
Yeah, well, I want to add my thanks as well, Kevin and Summer. Really appreciate having you here today. I don't have a whole lot to add. I think that we were considering if someone from CBHC or the Colorado Behavioral Health Council could be here today to add some comments, but they weren't able to attend. So essentially, CBHC is a member organization for community mental health centers, as well as other safety net providers for behavioral health here in the state. And I think a lot of CBHC members, as well as staff, were really very involved in the Behavioral Health Task Force, had the opportunity to serve on the task force itself, on some of the subcommittees, brought back a lot of information for some very lively discussion throughout the year as the task force proceeded. And I think that the important pieces that came out of that process for CBHC, I think were very well presented today. They are, and some, I think, Rich, of what you were mentioning as well, that we want to make sure that we're staying really connected to the budget and making sure that the activities that are happening as they move forward, as well as the final plans, don't pull dollars out of client care to support more administrative costs. And so that is just something that we're going to stay connected to. And certainly if we see that happening, that can be something that I can bring back to the group for advocacy. I think our biggest concern with that right now is in a later phase. It's in that phase 2 with the idea of the care coordination structure that's being proposed, which really in some ways, which in some ways replicates some services that are already existing, but creates a new administrative structure. Whenever a new administrative structure is being created, I think for me, that's the one thing that makes me concerned that we need to pay attention to, that we're not duplicating, and that if we're establishing new costs, we're pulling those monies from other administrative cost centers rather than from client care. I think the other really important thing from the CBHC perspective is that integration of Medicaid and commercial insurance. Because if you look across the state, the vast majority of people who are served or who require services in the behavioral health system or any health system are those two groups. You know, the groups that are being served with dollars from the rest of the system are really the minority. The Medicaid and commercial insurance is going to be the majority, regardless of how you look at it. So just wanting to make sure that we're not, that integration happens in an effective way, and it doesn't end up being two systems, because that's sort of what we already have. And certainly we want to reduce complexity, But the reduction of complexity is important not from the administrative perspective as from the client care perspective and client perception perspective, right? Like, what do I do if I need services, and how do I get the advocacy and support I need in that? So that's just another thing that we're going to be paying attention to, that cost shifting piece, and then the integration piece.
Awesome, thank you. Yeah, it'll be exciting to see how the Behavioral Health Administration starts out and what the learnings are from that through the 2024. So that'll be exciting to see the evolving of the administration. So thank you for that. So we have a few minutes left. I want to open it up for just some community announcements. If you have anything that you'd like to ask or resource you'd like to share around behavioral health, an event, program. Laura, I don't know if you want to just mention that about you put it in the chat there, the Spark the Changes mental health wellness program. Hi, Laura.
Yes, hi. Hi, everyone. I just mention that Spark the Change Colorado does have a mental health wellness program. We've had it for quite a few years. It is mostly available in the Denver metro area, but we have a strong presence down in Pueblo. But we do engage pro bono therapists who would be able to provide at no cost to clients some telehealth currently during the COVID period. Hopefully we'll see the light at the end of the tunnel on this, but I just wanted to make sure that people were aware of it. It's not a crisis center or call center, but definitely for individuals who maybe can't afford that copay that they have for a therapist. And I put in the chat box the contact of our director who's in charge of that program. And we're really ramping up during this time to be able to assist clients. Thank you.
And Laura, is that for any age adult, or is it for?
It is for any age adult.
Okay.
Right.
Thank you.
Uh-huh.
Any other questions, announcements?
Share an update, just briefly. I think, we had, maybe it was 2 behavioral health meetings ago, I can't remember for sure. We talked a lot about how a lot of providers had shifted to telehealth services. Since healthcare providers are prioritized for vaccines for COVID, I think a lot of us have been really targeting making sure that our staff are vaccinated so we can come back to in-person care. So we are really targeting an increase in in-person care starting March the 1st at Aurora Mental Health Center. Certainly we've maintained our crisis and our detox and some of our other in-person services, but we'll be ramping those back up starting in March and continuing to do a hybrid approach, knowing that some clients regardless would prefer to receive services virtually. So getting ready to start making that transition. And then just another announcement, Aurora Mental Health was awarded funding from SAMHSA last year in their, what they call their Certified Community Behavioral Health Clinic model. And what that is a model that SAMHSA has developed that is akin to a federally qualified health center model at the federal level that has about 120 kind of quality criteria that are attached to it. So with that funding, we've been working with SAMHSA and have completed all of the work that we need to do for that. So we are now the 2nd certified community behavioral health clinic in the state. So we're proud of that designation, and we hope that that program really increases. More centers get funded in order to kind of increase their ability for access to care and for quality care. And that we hope also then shifts the funding system in the state at some point. It's the funding system with Medicaid and with the sort of very complicated system that Summer and Kevin presented is a real challenge to maintain. So we're hoping for a more sustainable model, like the model that the federally qualified health centers have as we move forward. So that will be something that CVHC will be working on from an advocacy perspective.
Excellent. Thanks for sharing that. All right. Any other
Just something
questions?
on the local level. The Tri-County Health Department has been facilitating Aurora Substance Abuse Prevention Coalition group of folks, and we're now the Aurora Partners for Thriving Youth. The intent is to bring together all the various programs that are out there, work together to promote healthy living, including the avoiding substance abuse, reducing the risk factors, increasing the preventative factors. So one thing we think we need for youth is to actually get the voice of youth. So what we're doing right now is we have some mechanisms now to work with the kids in the school, the young people in the schools, middle and high school, and get their perceptions on what the issues are that are risky and what could be socially acceptable for young people to prevent the things that are risky. So we'll be working with that, and then we'll be reaching out to rest of the Aurora community and its various hodgepodge of, we have lots of things going on with youth, but we're not talking to each other. So how to bring us together in a more unified way and really focus in a very strong way and a cogent way to emphasize great things, good things that kids can be involved in and do to improve their mental health, emotional health, physical health, and just make it an Aurora-wide commitment. I know Aurora has some agreements with Denver on empowering youth. I don't know where they're going with that, but it would be something like that, maybe with working with Aurora and maybe with Denver to really put some strength and energy behind activities and good things and programs and for kids. Like I say, there's lots of good things out there for young people, but no one knows about them except for handfuls. So how are we going to bring it all together and focus it so the whole community knows the programs that are out there? But anyway, I just wanted to let you know that that's something that we're working in under the umbrella of Tri-County Health Department.
Awesome.
Thanks, Rich. Yeah, please continue to keep us updated on what the group's doing and how we can help.
I did just think of one other thing that is a more general update. There was an addition to the Medicaid benefit for behavioral health that started January 1st. I don't know if this is anything folks are aware of, but the substance use disorder treatment benefit was enhanced starting January 1st for Medicaid recipients, and it now includes a continuum of residential care. Residential was not previously funded by Medicaid. So it's a process. I think that the RAIs are now responsible for those programs. They're bringing those providers onto their panels and setting up the structures for referrals and billing and all of that. But those residential services are now a Medicaid benefit. So it used to be that, at least from our perspective as a detox provider, that people would come into detox and then there was not really a good option for them for treatment following that withdrawal management stage. So we're hoping to see some additional resources being developed now that there are more dollars in the system.
Yeah, thanks, Kathy. And I think it'll be interesting to have maybe some discussion about what it's looking like later in the year or something to see how that's played out and, challenges, successes, et cetera.
Yeah, there are definitely early challenges, but it's hard to get a system to shift like that.
Sure. Yeah, thank you. All right. Well, thanks everyone very much for your time. The next Behavioral Health Interest Group meeting is May 12th. So keep your eyes out for that. And we will send a follow-up email about this meeting that will include the slide deck and any other resources that were mentioned. So thanks all for being here. Really appreciate it, and stay safe.